Hi, I'm Dr. Heng Hao. I'm an IVF specialist with the Thomson Medical Group. I've always dichotomized the well-being of a pregnant mother and IVF itself. IVF is a procedure to help patients conceive. The moment they conceive, they enter into another chapter whereby they may face the risks of pregnancy, and that's contingent on their age, on their underlying medical conditions. They are quite different in that sense. Personally for me, I've always sat patients down and run through slides showing them the IVF process, and simply put, it's divided into two parts. The first part is about harvesting the eggs, culturing the eggs, and that means giving them injections on a daily basis. Usually it takes about 2 weeks, thereabouts, and then we will then extract the eggs from the patient's bodies. Then the journey begins in the lab. We'll pass the eggs over, and then with the husband's sperm, we'll inject every sperm into every egg. And that's where our colleagues, our embryologists will help to culture the embryos into beautiful blastocysts and embryos. And then we will decide whether to transfer them back into the body at the same sitting. And this is known as a fresh transfer. Or we freeze them first to be transferred in a subsequent month. And that's known as a frozen embryo transfer. It's my firm belief that all IVF doctors are competent. We are all competent doctors. We were trained from the same school. We came from the same stock. But what we need to learn and need to apply to be more than just a doctor, to lend a listening ear, to journey with them, to hold their hands, and hopefully this leads them to the bigger success of having a kid of their own. The first thing is they have to be convinced that they need IVF. That's the first step. And you'll be surprised that when couples are already convinced they need IVF, a lot of them are already distinction students. They've done whatever they can, and they've done more than what I would expect of them. Generally, there are a few categories of preparation. One would be the psychosocial, which they would have already been well prepared. The second would be they would be on cycles of supplementation. For example, vitamin D, vitamin E's for the husbands. And lastly, a good proportion of them embark on traditional Chinese medicine. And then when the IVF journey begins, it's important to have a good team. And that's where I think partnership with Thomson helps because of their experience in this field of IVF as well. There are a few important ingredients in the success of an IVF. Number one, improvements in technology in the lab. I think as of today, even Thomson is talking to me about the future in research in AI and robotics, etc. Right? So that's lab advancements. Number two, the use of surgery to help improve. Reproductive surgery, I've mentioned that before, is a concept whereby you perform surgery on a patient to help improve her chance of getting pregnant and even improve the success of IVF. So there are certain conditions that can be improved to maximize their chances in IVF. Number three, progressive changes in local legislations. As we know now, there's egg freezing. Hopefully we see further amendments to our local legislations. And number four, which can never be replaced, pure determination and grit on the part of a patient, what I call resilience. Now, for a successful case, you just need these four components. And that is why I find IVF itself very intriguing. It was, I think, sometime in 2020 when government first lifted the age limit for IVF. In the past, it used to be kept at 45 years old. I think it was during COVID that the legal age limit was removed. I had a couple come and see me. They were about, if I'm not mistaken, 46 and a half, nearing 47 at that point in time. They have failed a few cycles of IVF overseas, but because they were stuck in Singapore, they had to do IVF in Singapore. It was an interesting case because it highlighted the four ingredients that I mentioned about. One would be resilience of patients, advancements in lab, surgery, and changes in legislations. This was a case that exemplified these four important ingredients for any IVF success. So she had a womb condition as well, what we call Asherman's, scarring. So prior to the IVF, we had to remove the scarring from the womb. We put her through IVF. I put her through IVF. I harvested 2 quite beautiful blastocyst. It was interesting because we were preparing her for the transfer, and just a few days prior to the transfer, she wanted to call it off because she was having a bit of cold feet. She had failed too many times. So again, we encouraged her, we set her through this process. Well, the long and short is when we transfer, and she's now pregnant and she delivered to a healthy baby boy. And I still think it's the oldest live birth in Singapore at about 47 years of age. So this is what I meant where we have the 4 ingredients of success: surgery on her womb to improve her implantation, grit of the patient, determination, she never gave up, advancements in lab to culture better embryos, better blastocysts, and most importantly, a progressive change in our local legislations that remove the legal age limit for IVF. So I've been asked these questions many times. Dr. Tan, is this the end of the road for me? Should I give up? When is the end point? Again, I will never ever tell a patient to give up. They have to make that decision themselves, but I will give them some pointers to help them arrive at that decision point. Number 1 is about finances. Number 2, it's about the ability, the resilience to stomach the treatment itself, which includes injections. And number 4 would be the reasonableness of success. Now, finances, I've always said, the moment they have sat in our clinic and engaged us on the use of IVF, I think financially they have worked it out and they're able to undergo financially further treatment cycles. Number 2, resilience, I think they've worked it through themselves. If the fact that they sit down before me, they are willing to undergo the injections again. Now, what they want to ask is reasonableness of success. Now, what is reasonable? Again, I use the word reasonableness. It's something quite individual. As long as it's not 0%, well, I tell patients there's something that they have to think about. Whatever misgivings or doubts they had about success rates, it's not going to get better. And if it's not going to get better with age, it's now or never. So at the end of the day, they have to come to that decision themselves.